Hello friends, welcome back to my channel Concepts in Community Medicine. This video is about the concept of glycemic index. So let's quickly get started with the discussion. To understand this, we must know about the basics of carbohydrates. We all know that 55 to 60 percentage of our energy comes from carbohydrates. Carbohydrates are classified as simple and complex. Simple carbohydrates includes monosaccharides like glucose, galactose and fructose and disaccharides like sucrose, maltose and lactose. On the other hand, we have complex carbohydrates which are nothing but polysaccharides. So this can be the starch and the non-starch polysaccharides. Non-starch polysaccharides are basically the dietary fibers. Now let's understand how do carbohydrates get digested in our body. These monosaccharides needs no digestion prior to absorption, whereas disaccharides and polysaccharides must be broken down into simple sugars before they get absorbed. The digestion of carbohydrates begins in the mouth, where the salivary glands secrete an enzyme called as alpha amylase, which initiates the hydrolysis of starch and breaks it down into dextrins. The carbohydrate digestion gets halted temporarily in the stomach because of the high acidity which inactivates the enzyme salivary amylase. Further, the digestion of carbohydrates occurs in the small intestine in two phases. One, it is due to the digestion by the pancreatic amylase enzyme, and at the second phase, it is due to the digestion by the intestinal enzymes. So, this pancreatic amylase enzyme further breaks down dextrins into disaccharides. And with the help of the intestinal enzymes, these disaccharides are broken down into monosaccharides with the help of the enzyme disaccharidases. So the end product of carbohydrate digestion are glucose, fructose, galactose, which are basically monosaccharides, and they get readily absorbed through the intestinal mucosal cells into the bloodstream. Hence, carbohydrates are absorbed as monosaccharides from the intestinal lumen. So now you must have understood that simple carbs get easily digested and readily absorbed into the blood when compared to the complex carbs which take some time to get digested and absorbed. So simple carbs immediately increases the blood glucose levels and they are said to have a high glycemic index when compared to complex carbs. Now let's check out the definition of glycemic index. Glycemic index refers to the ability of carbohydrate containing food to increase the blood glucose level following its digestion and absorption. It is assessed by performing a glucose tolerance test after eating a particular diet and comparing it with a reference meal. So here the reference meal is 50 gram of glucose. So glycemic index is calculated as incremental blood glucose area of 50 gram of test carbohydrate divided by incremental blood glucose area of 50 gram of carbohydrate reference food, which is glucose, into 100. Different food items have different glycemic index because glycemic index is affected by many factors starting from the type of sugar, the protein, fat and the fiber content of the food and even food processing. So generally the food items which contain protein, fat and fiber, they have low glycemic index, and foods which are processed and which contain simple sugars, they have high glycemic index on the other side. So glycemic index is categorized as low, medium and high glycemic index. So with a score of less than 55, it is called low glycemic index. Between 56 to 69, it is called medium, and greater than 70, it is called as high glycemic index. Now let's see the relationship between glycemic index and diabetes. Suppose an individual consumes high glycemic index meal, the blood glucose levels immediately shoots up. Now the hormone insulin, which is a glucose regulator, comes into action and initiates glucose uptake by the cells. If the individual continues to consume high glycemic index meal with still increase in blood glucose levels, there is more insulin demand from the pancreas, which is called as hyperinsulinemia. Beyond a point at which the cells stop responding to the hormone insulin, and do not take up glucose anymore, increasing the blood glucose levels, which is called as insulin resistance. During insulin resistance, the activity of hormone sensitive lipase in the adipose tissue is increased, which breaks down the triglycerides into glycerol and fatty acids, thereby releasing the free fatty acids into the blood. Hyperinsulinemia, insulin resistance, and increased free fatty acids increases the risk of developing diabetes mellitus and metabolic syndrome. On the other hand, easy digestion and absorption increases hunger and overeating and leads to overweight and obesity. Also, insulin resistance and increased free fatty acids increases the production of reactive oxygen species, which increases the oxidative stress, thereby still increasing the risk of developing metabolic syndrome. So long we discussed about glycemic index. Now there is another concept called glycemic load. Glycemic load measures how high the blood glucose levels will rise after eating a specific amount of a specific carbohydrate. It means that it includes both the quality and also the quantity. Quality, that is how quickly the blood glucose levels will increase, which is glycemic index, and also the quantity, that is the amount of carbohydrates. So, glycemic load is a much better tool to measure the food's impact on blood glucose levels than glycemic index alone, because it also considers the amount of carbohydrate in a portion. Glycemic load is calculated as carbohydrate in grams into glycemic index divided by 100, and it is categorized as low, medium, and high. A score of less than 10 is low, 11 to 19 is medium, and greater than 20 is a high glycemic load food. Now let's take an example of watermelon. Watermelon has a glycemic index of 72, which is higher on the scale. But one serving of watermelon, around 120 grams, has only 7 grams of carbohydrates. So if you calculate the glycemic load, it comes to around only 5. So making it a very low glycemic load food. It is quickly absorbed into the bloodstream since it has a high glycemic index, but it doesn't have a lot of carbs. Eating low glycemic index food doesn't mean the blood sugar levels won't increase. You can still experience a higher spike depending on the portion you eat. So, eating a larger portion of low glycemic index food can still increase the blood sugar levels. Hence, portion restriction is mandatory when it comes to controlling of blood sugar levels. I hope you must have got a better understanding on the concepts of glycemic index and glycemic load. So if you find these videos interesting and useful, please do consider subscribing to my channel and also comment below for more such videos. Thank you.